where we can actually go observe, experience the challenges and the struggle which these stakeholders are facing in the field. And I think we have gone to North Karnataka, Rajasthan, and Tamil Nadu. So we actually travel to rural, suburban, tribal areas of these states. Arun, please add wherever I am missing something. I'm just recalling our journey again. And we tried meeting different stakeholders in this maternal child care, because the theme which was there was maternal child care. So we traveled to, we went there to meet caregivers and also care seekers side. So when I say caregivers, I meant, hospitals, hospital managers, doctors, obstetricians, nurses, biomedical engineers. We also met actually the people who comes in the entire workflow. Similarly, we also tried meeting parents, expecting parents, the parents who actually just had a baby or some kind of complicated pregnancy, and how they are actually taking care of the baby once the baby is delivered. So we tried noticing a lot of issues, and we did this in urban context as well as the rural context. And I think we both have observed that the problems are equally prevalent, though the intensity of the problem is different, but definitely problem persists in both the contexts. I think because you spent about 6 months of time, it took us, I think Arun and I, we were just noting, we had diaries with each other. I remember Arun had a tablet which he was actually clicking pictures from. We tried, I had a camera and a notebook where we were actually recording, taking notes wherever it is needed, having conversation, and taking down most of the observation. Rather than asking direct questions, we thought of having a conversation where they can open up about their daily challenges, what do they do on a daily basis, where they are struggling. So for example, we remember we talked to this biomedical engineer who's talking about this sugar monitoring device which they were using. But then they talked about very interesting problem that of the consumable, where they actually take the blood from, and they were not having those kind of strips. So for them, innovation like that was totally meaningless because they were not able to use it. And I think listening to their conversation, listening to their struggle on a day-to-day basis, literally helped us to identify what are the challenges which we can actually try solving in future. So we both had a list of really long list, I think, of the issues, both from parents, mothers, fathers side, as well as doctors, obstetrician, and ASHA workers side. Arun, please add, I think, your experience, please, and then we can definitely conclude on something.
Yeah, thanks, Shivi, thanks, Ragini. So I think very, very important program, or you can say a fellowship, somebody who is looking to solve problems in social healthcare or maternal and child healthcare through technology. So this actually gives you a leverage to identify a problem. This is a program where it's paying you money to actually identify problems, and you will not get this anywhere else. So if you're really passionate about solving the problem through technology, this is the right program in maternal and child healthcare. And that is where our journey started with Wilgrow. And we actually have started traveling in the rural area, urban, semi-urban, which includes east, west, north, south. And the partners like Wish Foundation, Karuna Trust, and a lot of other foundation, private hospitals, missionary hospitals, government hospital. The thing is, you have to observe a lot on their day-to-day activity. And I think the Shivi, coming from the design background, really helped me a lot, like how you actually observe people, how do you do that sort of a research? Because I'm coming from a technology or engineering background, from biomedical engineering and electronics. So that really matters a lot. Number two, which I would love to say, is because this is now in maternal and child healthcare, so before you step up into a field, you please do your basic research of understanding some knowledge what exactly maternal and child healthcare looks like. You do your secondary research, Google search, and just try to learn on the basic understanding what's happening in maternal and child healthcare, what is maternal mortality rate looks like, what is infant mortality rate looks like, why people are dying. So basically you can have the theory knowledge, and then if you go on field, start talking to people, you will start connecting the dots. And if you see that there are a lot of problems which people just get settled to in their life, and they will not even say that's a problem, and that is what you have to observe. Keep talking to them, and if you see that it's coming out as a pattern, if you're talking with the 10 stakeholder, let's suppose you go to 10 hospital, and you are talking to 10 staff nurses in 10 hospital, and if you see that's a similar pattern, you can see that you can actually start identifying, oh, you can actually see the same pattern, and that could be a problem statement. So that is one thing. So 6 months, please spend your time, just identify what's happening on field, just gain your knowledge, take a lot of interviews from these different stakeholders. Maternal and child healthcare is really big, starting from the mothers and their family, then the stakeholder like healthcare professional, doctor, staff nurse, OBGYN, midwife, ASHA worker, and the healthcare professional, state government, the foundation who are working in maternal and child healthcare. So just think about each and every stakeholder who is playing in maternal and child healthcare. And then, because ultimately whatever you are going to design is also, your business model is also going to vary based on that. So that is one thing you have to take care. But this is an important program, and a very important thing is relation, because I'm sure IIT Kanpur is going to introduce you to a lot of foundation, government, hospitals for you to do your research and immersion. So making relation from the day one with them, when you are doing your research with them, and then doing pilot with them, and further they become your customer, that is a journey you have to look for with every stakeholder from the day one. This is what at Janitri also we have seen. I've spent a lot of time with a lot of stakeholders, and now they are our customer. So that means they are believing in that journey. But apart from that, you also need to do a lot of brainstorming with because apart from the impact, it has to be financially sustainable. When you are going to create your own product, it has to be financially sustainable. That means it should have a business model around it. So at the same time, IIT Kanpur should also bring the business people on board to actually have a brainstorming around the business model side as soon as there is an idea. So it can make sure that for whom they are developing the product, what they are developing the product, and how they will sell it ultimately. Because if there's no business model, then nobody is going to invest in you straight away. So I think that is also one thing they need to take care. That's a very crisp but very important program. Shivi, you can add on this.
Yeah, I think Arun and I, we have learned from each other even during this journey as well. I remember Arun was sharing his experience of running a startup already from his college days. Do you remember that conversation? We were in this tribal village, and we had like literally, we thought like, what is this world? Because there are literally nobody out there. We cooked some food, and we actually were having a conversation on the startup. For me, it was totally a new journey because I'm a first generation entrepreneur. Arun had an experience of running I think tech startup, and then he was sharing his experience of how to innovate on business models as well, and that literally kind of helped me to also understand. Yes, solving a problem is the one thing, but taking that problem and then turning that into a business is totally a different ball game altogether. So I think my one of the advice or one of the suggestion I would like to actually leave all of you with is, please make sure do not just jump into any of the fellowship or similar this fellowship, because it's a commitment, right? 18 months is a very, very important time, especially for an early career time, right? So when you actually jump into something like this, make sure you are actually committed to it and you're passionate about it, because I think the passion is something which will take you for a longer journey. Because if, yes, you can be, very excited about a problem when you actually see it on the field and maybe some idea comes to you, but taking that forward, because this idea or this problem will live with you for a longer time, till you actually make it a reality. So make sure you make up your mind, you speak to a lot of people, you speak to existing entrepreneurs. They could be, very new entrepreneurs or, startups, but they could be established companies as well. If you have a network, find a network and speak to these people. Make sure you have a good relationship with mentors as well. So the mentors who I'm sure IIT Kanpur will provide, have a good relationship, with them as well, where you can actually speak about everything. I remember there was a day where I literally cried my heart out and I said, no, I cannot do this. This is, even after fellowship, how would I run a company? How would I do this? And I literally cried my heart out. But then there were these mentors, who actually helped me, who sat down with me, and they actually helped me understand that why are you doing this? Once you understand the why part of it, I think then I don't think there would be any hurdle, because you will find a way out. It is not going to be easy. Yes, it will be very interesting, very exciting, but it is not going to be easy. So make sure when you when you actually come into this kind of domain, please be committed to it and try to find a problem. Try to find a problem which is very, very close to your heart, because you will find once you spend like 6 months. I remember I had about 100 plus list of the problems, and I think Arun was also having the same list. And then but narrowing down to one problem literally was a challenge. I remember how many days, how many weeks we actually spent only narrowing down on one issue. So everything will be there, but make sure you enjoy this journey. Find very interesting problems which are not even solved in the past. So look out, as Arun rightly suggested, look out, who are the people who are working in this field. Read some reports from WHO, UNICEF, UNESCO. They publish this very, very authentic research data. So please read this. Pandemic has actually created a lot of opportunities. So make sure, you can find a lot of opportunities in this space as well. So yeah, I think that's all from my side.
Yeah, I think it is a very, very interesting journey. And no, I don't. It is actually a program which has been designed based on the Stanford India Biodesign Fellowship, where this whole biodesign process you follow. And very interestingly, you spend time with the stakeholder. For example, if I need to talk about my journey in a very crisp, in 2015 October, I think we have started our journey. And I remember that as soon as I was clear on my problem statement in 2016, I have registered Janitri. And because now you are going to get the 5 lakh rupee to actually create your prototype in this fellowship. And ultimately, as soon as the problem statement is clear, then you need to quickly hire a few interns, make sure that prototyping started. And because that is actually going to give you the next round of grant or funding from BIRAC or some other organization. And BIRAC is there actually to support you at each stage. As soon as you are progressing, for the prototyping, for then further product development, pilot, clinical trial. And in last 5 years, we actually got supported by BIRAC in the multiple phases and other foundations like Bill and Melinda Gates Foundation, Government of Canada, Government of Karnataka. So we have almost raised $1 million in last 5 years for our whole product development, pilot, clinical trial, regulatory, ISO 13485. And now we are in a market. It's a complex product which we have developed, but now we are in a field that now we are selling product to the same people, and it's actually solving the problem which we have identified 5 years back. So it is going to be an interesting journey. It just need a commitment, your passion, and apply for it if you are really looking to have your social entrepreneurial journey. Talk with each and every stakeholder which IIT Kanpur may going to connect you and be open to talk to. So I think we can open the floor for the question and answer. That might be more helpful.
Thank you, Arun and Shivi. So there are two questions in the Q&A box. And after I address these, I will just request everyone, urge everyone to raise their hands so that I can allow them to ask the questions themselves. So there's one question for Kaushal that says, can an individual apply, an individual who's already working on a social health issue? So it depends, Kaushal, in what capacity are you working? So if you have a full-time job that you are pursuing, or you are already have a startup of your own, it will not be possible for you to devote time to the SPARSH fellowship. We require fellows to be a part of the fellowship full-time and not pursue any education or any job simultaneously. So if that answers your question. If not, then if we could just raise your hand and we'll take it up later. Another question is, how is the actual problem and innovation interconnected, and how to understand the market need? So I think this I would probably ask Arun and Shivi to pitch in, that if you could maybe highlight a bit on how your SPARSH fellowship problem statements ended up being converted into the product that is in the market today. I think that will answer this question. So if both of you can please pitch in. Thank you.
Yeah, so I think very crisp, if I can talk about my problem statement and Shivi can talk about her. So for example, when I have started spending time inside the labor ward, because that is also one of the phase in the maternal and child healthcare, after a pregnant woman start getting a labor pain and then she get admitted in a hospital setting, whether it could be a private hospital, government hospital, primary, secondary, tertiary. So there, what I have started observing, and which also backed up by the data by WHO or UNICEF, that a lot of mothers and newborns were still dying during that phase. And numbers were really too high in the developing world. And then I've started more digging down into it, like what exactly happened during the whole phase. So we have actually seen the live deliveries, C-section and all. And that was really, opened up our eyes, what's happening the whole phase after she get admitted, till she deliver and till she get discharged. So when I have started digging more into it, I figured out that there are a couple of parameters which supposed to be monitored during this phase to actually prevent the stillbirth or fetal distress or any other related complication, but which was not happening there. And the reason was very simple. One is we have seen that there were poor staff versus patient ratio. There were 10 deliveries was happening and only 2 staff nurses was there. Number 2 is we did not find the easy to use medical devices. No interpretation, no result. Skill was also an issue. So that is where we found the gap. And then we have started researching more on the product side, like what exactly exists in the market across the world, which is solving this exact problem. Is there any product which is affordable, which can monitor all these parameters, which is super easy to use for this healthcare professional? We did not find anything. And that is where then we found a gap, and the similar pattern have started coming from the different hospital, and that we have started validated then. And then we figured out that, okay, market actually needs something which is affordable, which is easy to use, which can monitor these couple of parameters, and which can also give some sort of an intelligent alerts. We don't still know how the solution will look like, what technology it's going to be used, but at least that need was clear. And then we have started discussing with the technical mentor, started doing some technology research, technical R&D to see whether it is really feasible or not. And that is how the need got converted into a product. Shivi, you can also add it. You're on mute, Shivi.
I think as Arun also mentioned that, he spent a lot of time in labor ward. We both have witnessed live deliveries, taking the baby, right from the moment mother actually looks at the baby and smiles, and then, baby is actually going to, for the first bathing, for first feeding, and then, changing baby's clothes and everything. I think the key to this question is the more time you will spend on the problem, observing this, I think you will have higher chances to find a better solution. for listen to more. If there, you must be hearing a lot of stories throughout your travel phase. But if there is something which is really, really interesting to you, where you find, oh, this is very, very interesting, and for example, for us, one of the key thing which keeps coming in, where, a lot of mothers talked about where they actually lost their pregnancy, and they were talking about, like, my baby was dead and I did not know why. And, looking at that story, it actually made me question over and over again. And then even after immersion phase, I went to some of the doctors in Bangalore as well to understand whether this is actually, my thought, because losing a pregnancy altogether it's like the end, right? Like, you cannot do anything after that. So, but if you are able to solve, or if you are able to save life, even by monitoring some of the parameter or one of the parameters, it is game changing. And that literally helped us to understand that, yes, we need to find an innovation which can actually bring parents to caregivers as soon as possible, so that that golden period, where you can actually save life, can be used well. And that is the opportunity for us. Like, similarly for Arun, it was actually the labor, because that's also a very, very critical phase. So that labor period was the golden time, and to find, to conduct some innovation. So I would start, rather than just focusing on innovation right from the beginning, focus on the problem, identify each and every layer of the problem. Once you get that right, I think you can solve the same problem by 1,000 ways. So you can definitely, find 1,000 innovations to solve that. But make sure you understand the problem really, really well. You master that problem, and then I think innovating on that problem would not be a challenge at all.
Thank you, Shivi. So there are other short questions I would quickly run through. So Sandeep has asked if this is an in-house program or do we keep traveling? So Sandeep, this program 18 months is divided into phases. There is a pre-immersion phase where most of this subject to COVID is going to happen, we believe, online. There are some workshops that will take you through the basics of entrepreneurship and how you integrate field work with identifying problem statement, and later introducing that problem statement to developing your prototype. Then we have an immersion phase where you have to be on the field for 5 to 6 months, because like Shivi and Arun explained here, it's absolutely critical for you to be in the shoes of the beneficiaries and experience the problem, because only then you would be able to add value to the product that you want to develop. So this critical fieldwork is for 5 to 6 months, after which you come back to the center. So IIT Kanpur, if we are your hosting center, you come to IIT Kanpur and avail all our facilities, connect with the mentors that we have assigned to you, and you continue your work in the labs here. So it's a blend of in-house program, in-house and travel, if I think that would be the best way to answer this. Another question is, Vipasha, if you are eligible to apply, if you already have an idea and startup. So Vipasha, if you're full-time devoted and working in a startup, if it's your own startup or you're an employee there, then you are not eligible to apply. If you are in a job, you will not be able to continue that job alongside SPARSH fellowship. And similarly goes for an education degree or anything else that you are devoted to full-time and earning money from. So if you are a SPARSH fellow, you're only a SPARSH fellow. So that is for the 18 months of the program, it's a full-time fellowship. I hope that answers your question. Alhaz has asked how the collaboration will happen. So Alhaz, each fellow has their own problem statement that they have to develop and work on. What BIRAC allows is that if eventually you realize that your problem statement is very similar to the problem statement of another fellow, then the both of you can collaborate. But that happens at a later stage when you are going to finalize your problem statements and start developing a prototype. So there is scope for collaboration, but not outrightly. That is something you explore with other fellows during the course of the fellowship. So most of you are working solo by default. Okay, and so Priyanka has asked if she can apply. She's from commerce background. So unfortunately, no, Priyanka, you have to be from a sciences, engineering, or a medical background to be able to apply for the fellowship. Mridula, no, you cannot use this explore the fellowship as a part of your PhD work, because we do not take currently enrolled PhD scholars as SPARSH fellows as well. You have to have completed your PhD or at least cleared your defense in order to appear for the SPARSH fellowship. Then Sandeep has asked, does the travel cost and other expenses are reimbursed separately? So this stipend is something that you use to cover up your travel and fieldwork, Sandeep. So it is a part and parcel of your fellowship. So it is integrated into your fellowship so that we can support these expenses, because we realize that there's extensive fieldwork involved. So you will have to do it within the 50,000 a month that you receive. So I'm currently pursuing MDes at IIT Kanpur. So SPARSH fellowships are open till 30th of September, and if you are able to, if you're selected, you should be able to produce a provisional degree of MDes. Then we will be eligible to apply. If you are, let's say, finishing your degree sometime next year, then unfortunately you're not eligible. And Veer Sen has asked whether research and innovation in mental health for children and women is considered. Of course, Veer Sen, you are welcome to explore a plethora of problem statements depending on your fieldwork. And the point of the SPARSH fellowship is that the fellow has to come up with something innovative, likely something that has not been done before. It could be a process innovation, it could be a product innovation. So really all problem statements, as long as they're in the maternal and child health domain, are welcome if you want IIT Kanpur as your SPARSH center. Pinky has asked whether we can use this scheme for starting student project. No, Pinky, we cannot do that. Yes, does BIRAC make introductions to potential partners in hospitals, etc.? So BIRAC, we take help from BIRAC if required, but your center, in this case SIIC IIT Kanpur, is responsible for connecting you to stakeholders during your immersion. So we will be there with you at every stage of the fellowship and connecting you to whichever hospitals, potential partners, stakeholders you want to stay in touch with for the fellowship. There's a question that says if the PhD fellow is doing the research which now needs to be tested on the field along with problem statement. No, this is not possible, Sandeep. Again, any ongoing work cannot be clubbed with the SPARSH fellowship. Vipasha says that she's a founder of a startup and working on an idea already. However, would like to build up more on it during the fellowship. I'm sorry, Vipasha, you're not eligible for the fellowship. This is again, the objective of the SPARSH fellowship is that you have to come up with something entirely new and something that you develop from scratch. So like Arun mentioned, that once his problem statement was finalized, he registered January 3 in 2016. So that is the trajectory we are looking at when we see SPARSH fellows. We want them to start from scratch and develop on their problem statements, and then go on and form a venture, an organization, or whatever, however they want it to materialize. So anyone who is already working in a startup has already a step ahead of our SPARSH fellows. So this is not something that is for them. Neeru says she did M-Pharma. Am I eligible to apply? Yes, if you have a bachelor's degree in sciences, and you will be eligible to apply. M-Pharma also holds. Okay, I think we have pretty much addressed all the Q&A questions. So there's a question that asks, I'm pursuing Masters of Public Health. After I complete my degree, am I eligible? Masters of Public Health, not eligible. But if you have an engineering or any one of the minimum qualifications in bachelor's, an MBBS or a BTech or a BE, you are eligible to apply. Then. Yes, I think I have picked up almost all the questions here. So if anyone else has a question, I would request them to raise a hand. If I have probably missed answering your question, I would welcome you to raise your hand, and then I will allow you to talk. Okay. Pavandi, please unmute yourself and ask your question.
Can you hear me?
Yes, we can hear you.
Yeah, this question is more to Shivi and Arun. Well, I'm trying to understand, at times understanding the problem of these people, their said and unsaid needs can be difficult to understand. What they say could be completely different what they are actually suffering. So how could they address that problem? What are the different techniques they use to understand the real problems of these people?
Is the question over, Pawan?
Yeah.
All right. I think it's a very, very valid and very important question. Arun, please add wherever you find it. I think definitely, see, we all are not expert, understanding what people are actually facing. But we need not to be expert. This is because this is why this fellowship is. This is why there is a 6 month, dedicated time given to understand this and to learn this on the field. So I think to answer your question, yes, when you hear the story once, that's not your final problem. But when you start seeing the same story over and over again, same problem over and over again, like a pattern, like Arun also mentioned, when you start finding those patterns, and then that would click you, and that's where you need to find it better, or dig deeper, that yes, this is a problem area, but what exactly is causing this issue? Where is the gap? And if there is a gap, is there an opportunity for me as an entrepreneur or as an innovator to bring in some solution? And your solution could be anything, your innovation could be anything, like a product design or service design, or maybe like, it could be like lot of like digital or a hardware, whatever wherever your strength lies. You can try solving that problem from different point of view, but as I said, start looking for those patterns which are coming over and over again, where you are finding, because if there is a problem, you will see this multiple times in this 6 months period. It's not like, you heard it just once and then it never came up. Then that is not a problem, because that could be one person's experience, but that's not the problem which is worth solving through this fellowship, because you are solving social, this entire program is actually based on the social problems where you can actually create large social impact. So that's why Arun and I, we both have suggested, look for the WHO reports, identify those critical challenges, read about SDG goals, read about critical issues which are already listed. There are 1,000 reports out there. Start from maybe just 5, maybe the recent 5, and then find out, take a pen and paper and start finding what is interesting to you, and see that is there a reality, is this the reality same on the field as well, and that would definitely help you.
Yeah, right, Shivi. So I think very quickly, as I told you, because there are a lot of ways when you need to observe things, you need to shadow people, you need to talk to them, you need to interview them, and you start figuring out that there's some sort of a pattern coming out. And then you start going in detail and very, very minute detailing about that particular thing which you see. For example, if I take an example, you are visiting a hospital and you figure out that there is a postpartum hemorrhage has been done after the delivery, and then which is actually one of the major percentage which is contributing in maternal mortality rate. And then you start figuring out, you start talking to the staff nurse, doctor, like why this has happened, what did you do when the mother came to the hospital, what did you apply to prevent it, and you start going into the nitty-gritty of it, detailing of it, and you figuring out, oh, this is what happened, oh, this technology is not there, oh, this is the product they have used. If there was a product they have not used, then why they have not used that product? So this is how the detailing will start happening. Then you will get that pattern. So I think this is a mix of your secondary research, your observation, your detailed interview, your shadow process, your discussion with all the stakeholder, and you will start figuring out. That is why this whole 6 months you have the time.
Thank you, Arun and Shivi. Pawandeep, I hope that answers your query. Okay, I will move on to the next question. Alhaz is asking how much time will be given to form a problem statement after the immersion period. So Alhaz, it's so after the immersion period, you do not directly get your problem statement. Like both Shivi and Arun mentioned, they had about 100 list of 100. So naturally, you're not going to work on. We're going to work only on one. So you are supposed to come up with a set of problem statements after the fieldwork, and along with BIRAC, TISS, who is a knowledge partner for the program, and your SPARSH Center, SIIC, IIT Kanpur in this case, we help you finalize this one problem statement. So this period is about, I would say, of 1 to 2 months on paper, where you have to sort of get into a series of discussions and presentations, and after which you end up finalizing the problem statement. However, in my experience as a program manager, I think it's really a work in progress. From your day one of the immersion to the last day of your immersion, and the 1 to 2 months following that, you have to sort of keep developing your problem statements really. So I am sure that your day one on field is not going to, what you thought about things on day one of your field is not going to be the same on day 100 in the field. So as you develop with experience, with exploring and with talking to stakeholders, your problem statements keep developing. Objectively speaking, yes, it will be a time of about 1 to 2 months in between pre-immersion phase and prototype development phase where you finalize your problem statement. I hope that answers your question. Then, Uday Roy, you have done a bachelor's of dental surgery, so you are eligible to apply. So please go ahead and you're welcome to apply for the fellowship. So Masoom, you say you have an MS in IT and BSc Biotech. So it's in IT. I think yes, you are eligible to apply because you have an MS degree and you have a BSc in Biotech. So you're welcome. Role of biomedical engineering in SPARSH. So this is something I would want Arun to please take up and answer because I think he's ample of experience in the field.
Yeah, so I think I have done my master's in biomedical engineering after my bachelor's in electronics. So definitely it plays an important role for me. It actually plays an important role because when you start looking at the technology, you can quickly figure out the technology behind it. And so you know the advantage and disadvantages of those technology, at least, which are already there in the market, which are already getting used by the people or stakeholder. So you can even think more about from the technology perspective as well when defining the problem statement. So it's definitely going to be upper edge, yeah. But it cannot be the success factor, but it can just give you an upper edge, yeah.
Thank you, Arun. I hope that answers the question. So we have tried to address all questions. Just in case you think your question has not been answered, you can just stay in touch. You can drop us an email in the email address given in the chat box. If we have any further questions, I would request you to please type it in the Q&A or raise your hand so that I can allow you to speak. Okay, I think we are through with all the questions here, and I hope everyone is satisfied with the answers. In any case, you are free to approach us on the email ID given in the chat box. We will be also sharing a recording of the session with you so that if anyone wants to walk over through the entire thing, they are free to do so. If you want to apply for the SPARSH call with SIIC IIT Kanpur, you can again drop an email to the email ID I have mentioned in the chat box. We will be happy to guide you through the entire course of applying for the fellowship. And okay, we have somebody who raised their hand, so I would allow Ashish to talk. And this would be the last question that we would take, and then I would wrap up the session. Yes, Ashish, you can unmute yourself. Please go ahead.
Thanks, Ragini. So 2 quick questions. One is, as I understand, there are multiple centers which support this SPARSH fellowship. Does the applicant get to choose which center one wants to do the fellowship with, or is it a central process that once you get shortlisted for the fellowship, you get assigned a center?
So Ashish, you get to choose. So when you're filling the form, you will be asked your choice of your preference of the center, and you will be then automatically registered with that center.
Okay. And is there any circumstances under which the age limit criteria can be relaxed?
Unfortunately, no. I don't. There's no such leniency. I
Okay.
hope.
And one quick add-on question. Let's say I apply for the fellowship and I get selected. Then let's say it's a team of 2-3 people who are kind of working together. Can they also go to only the primary applicant like gets to travel for fieldwork and stuff, or can you take on your own expense teammates who work with you as well?
So two things. So it depends, Ashish, in what capacity are you working with them? Now, these are people you plan to set up a startup with in future.
Plan to hire, yeah.
I don't think there's any constraint on who you are taking along with you to your field work, as long as you're not formally tied up into any sort of employment when it comes to those people. So of course we understand that you're looking at this experience as a precursor to actually developing or starting your own startup or setting up your own startup. So you're welcome to explore the field as in in the way you please. However, the SPARSH fellowship will be allotted to you and only you as an individual. And even when you go on to develop a prototype, it will be attributed to your name.
Okay. Thank you so much.
Thank you for joining. I hope we've answered your questions.
You bet.
We have further questions, but I would like to take them on through email, if that is okay, because we are running out of time here. So, okay, so I would thank all attendees here for coming and joining us today and making this session truly interactive. We had a lot of questions, and I think, and I really thank Arun and Shivi for spending their time and walking all our attendees through their questions. And one thing before we leave, so I would just want to make very clear about the fellowship is that the entire mandate of SPARSH fellowship is to integrate social development with technology. And that is the reason we look for candidates who have solid experience in the technology sector, whether through an educational degree or through an educational degree mostly, whether bachelor's or master's. So I would reiterate this, that you are eligible if you have a bachelor's degree in engineering or medical, or if you have a bachelor's degree in sciences, then you should also have a master's degree in sciences or an MTech or a PhD. So the element of having this scientific background is absolutely crucial for a SPARSH fellow before applying for the fellowship. So, and of course, there's an age limit of 35 years that we cannot be relaxed. And you cannot be pursuing any other job or educational degree simultaneously with the fellowship. So you're 35 years old, you cannot be over 35 years old as well. So I hope that has answered most of our eligibility specific questions. Another thing I would like to mention before we leave is that, yes, the crux of the fellowship is that it is integrating social sector with technology. Hence, it's absolutely crucial for SPARSH fellows to come up with a problem statement that is actually going to benefit the stakeholders down the line. Like Shivi and Arun shared repeatedly, that it is something that has to be very close to your heart, so that you can 5 years down the line turn your SPARSH fellowship into probably your life's work and actually go on the ground and integrate your experience that you get over time. So we do not look at our SPARSH fellows as just people who we are paying a handsome amount of money, who can come and for 18 months they can explore the field and develop a product. We at SIIP IIT Kanpur want to train you into becoming entrepreneurs. We will equip you with facilities, infrastructure, and support, and tactical, technical, and business support, so that your product at the end of the fellowship actually has the caliber to turn into will be sold into the market and actually reach out the beneficiaries who you intended to with your SPARSH fellowship. So on that note, I would like to call it an end for today. And Arun and Shivi, if you have anything to add, please feel free.
I think my last words for this session, I think for this fellowship also would be just like you said, right? Like this is something, these 18 months are very, very important, right? Yes, you need to enjoy this, but make sure you take some value out of this. Don't just do it like, okay, it is 18 months and I'm in a very early career and, I'll be okay. Yes, it is going to be a very learning experience in your life. Arun and I will never forget this. I think whatever we do in our lives, but make sure you make your mind, talk to a lot of people before this. You have like enough, almost a month to apply. Discuss with a lot of people. Read about people who are actually already solving issues. If you can connect to them on LinkedIn or through some way, please reach out to them. Ask them. Arun and I, we have said to some entrepreneurs who are actually already solving problems. Luckily, we got chance to speak with them, how they are actually solving these issues. That really, really helps. So when you commit to these 8 months, make sure you are, these are really worth. Because after some 5 years, when you look back to this journey, make sure you don't regret that, I should have done it better. So please make sure. And there is nothing like, like somebody has asked, like, what is a good product? So I just read that question. So please believe that there is nothing like a perfect product. Your product will get perfect over a period of time, as soon, depending on how much time you're spending. Don't worry about the product right now. Worry about the issues you're actually going to solve. And I'm sure there are a lot of people have joined today, and 100 people are definitely can solve 100 problems. There are tons of millions of problems in maternal child care. Please, you all are welcome to join this tribe, which Arun and I, we are part of. Yeah, so all the best to everyone.
Yeah, thanks, Shivi. So I think from my side, I would love to say that please do not consider it as a fellowship. Consider that from day one, your entrepreneurship, social entrepreneurship journey have started. So if that will be in your mind, then definitely, so do not restrict yourself to that. Let's do that 18-month of fellowship and then we'll see what happens. So consider that now you are entering into a field where you are actually going to solve a problem and it's a long journey. So day one, start with your social entrepreneurship mindset, and wish you all the best. We are always one email or one phone number away for any discussion, any brainstorming, and would be happy to discuss on anything else in later.
Great. Thank you, Arun and Shivi, and thank you to all attendees who took out their time and asked us a lot of questions. So I've dropped in the email ID at which you can connect with us if you have any further questions. If you also want to further connect with Arun, Shivi, or any of the existing SPARSH fellows at IIT Kanpur, again, please drop me an email. I'll be happy to facilitate the connection. So thank you for joining, and you are welcome to apply to SPARSH Fellowship for the cohort. Thank you so much.
Thank you.
Bye.
Thanks so much. All the best, guys.
All the best.
Thank you, Arun. Thanks, Ragini.